what are some things some advice you give people so that they never have to darken the doors of a diabetes education department?
Well, I think the best thing to prevent diabetes from happening, and you can't ever say you're going to prevent it because some of it is genetic, but the best thing is lifestyle, looking at your lifestyle, exercising, eating right. I mean, it's the common sense stuff that we're hearing all the time. And in fact, we do have pre-diabetes classes. We do get referrals from physicians who have found that their patients, their blood sugars are a little bit higher than normal, but not quite high enough to be considered diabetic. We call them pre-diabetic. And we get them set up with the dietitian for meal planning, and we really talk about exercising and encouraging some weight loss. Those lifestyle habits that, if formed early on, can stick with you for a lifetime, that's what's going to prevent you from the likelihood of you coming in to see us with diabetes. Some of the things that we offer, aside from our classes, are the support group. We have a type 2 diabetes support group. It meets the second Tuesday of every month except for July and December. And we started that group because, of course, people, like I said, they finished their education with us, but they wanted something a little more, somewhere where they could check in with other people who had diabetes and learn what's the new medication coming out, that sort of thing. So every month we have a guest speaker, and the topics vary from diet, exercise, medications, to preventing complications. We're going to be having a foot doctor. We also will be having a neurologist come speaking about preventing stroke. So the support group is kind of the ongoing education once they're done with our classes. For the type 1 kids, we don't really have a support group, but we try and hook them up with JDRF, which is the Juvenile Diabetes Research Foundation. They have support groups, and they have mentors that come and talk to the families of kids that have type 1 diabetes. So we try and link them up with those services as well.